How to read an ECG. An electrocardiogram is a test that records the electrical activity of your heart. This test can help determine the cause of symptoms you might be having or check the overall health of your heart. Reading a basic EKG is not that hard. However, you should always let your doctor or medical professional properly read your EKG and diagnose you. Part 1. Identifying the parts of an EKG readout. Understand the grids of an EKG paper printout. Voltage. The electrical signals of the heart is measured along the vertical axis. Time is measured along the horizontal axis in squares. There are large squares that are divided into smaller squares. Small squares are 1 millimeter across and represent 0.0 for seconds. The large squares measure 5 millimeters across and represent 0.2 seconds. 0.10 millimeters in height is equal to 1 millivolt in voltage. Interpreting these values will help you determine if the heartbeat is irregular, or too fast or too slow. Find the Q or S complex and label it on the handout. The Q wave is the downward or negative dip right before the large spike. The R wave is right after that and is usually the largest spike on the readout. Following that is the S wave, which is the dip down below the baseline. Again, look at the peaks on the printout. You will need to look at the whole strip to check for an irregular heartbeat. This is a pattern called normal rhythm, and it's the basic EKG of a healthy heart. Many people's EKG may vary slightly from this baseline, though, while still being completely healthy. Assess your P waves. Find the P waves on your EKG. T waves are the smaller spikes right before the larger spike. The R wave. They should be at the approximately same duration, direction, and shape through the entire EKG. If they are not present, see if there's any movement to the line at all, like a flutter, sawtooth lines, or a flat line. P might just be a small rise or bump on the graph. They will not be as sharp or as high as the Q or S complex. Part 2. Interpreting the readout. Measure the time between your heartbeats. Locate the beginning of the P wave and the beginning of the Q or S complex. This is called the PR interval. Normal duration is between 0.1 to 0.20 seconds, which is 3 to 5 small horizontal boxes. This amount of time should be pretty consistent across the entire strip. If there is a varied amount of time boxes between beats, it can indicate an irregular heartbeat. This is only something to worry about if your doctor says so. It can be completely harmless. Assess your heart rhythm. You may have a regular or irregular heart rhythm. If your rhythm is irregular, it may be regularly or irregularly. To determine the rhythm, check if the intervals are the same length. Mark a few of your RR intervals on a separate sheet of paper. Use that sheet of paper to move along the rhythm strip to see if the intervals are all the same lengths. A regularly irregular rhythm has a pattern to the irregular rhythm. An irregularly irregular rhythm has no pattern at all and is all over the place. Calculate your heart rate. If the heart rate is regular, you can use the following formula to calculate your heart rate. Count the number of squares between the two peaks. DR waves. Take 300, then divide it by the number of boxes between the two peaks. In this diagram, it's 3 boxes, so 300 divided by 3 equals 100 BPM. If you counted for big boxes between peaks, you have a heart rate of 75 beats per minute. 300 quarters C equals 75. This is only used for regular heartbeats. Calculate your heart rate if the heart rate is irregular. If the peaks aren't regular and there are different amounts of boxes between them, the heartbeat is irregular. Count the number of spikes that are in a 6-second readout. and multiply the number by 10 to get an approximate rate. For example, if there are 7 or waves in a 6-second strip, the heart rate is 77 by 10 equals 70. Alternately, you can count the complexes on the rhythm strip, which represents 10 seconds. Multiply that number by 6 to find the 60-second heart rate.